Health benefits. They're a headache, whether you're an employer or an employee. Out-of-pocket costs, deductibles, co-pays, each another reason to avoid going to the doctor. But why does it have to be this way? At Gravie, we don't think it does. We're reimagining the employer-sponsored health benefits market, showing how small and mid-sized businesses can punch above their weight with benefits plans employees will want to use. We even think they'll love them. On It's a Gravy Thing, we'll explore existing and upcoming innovations in the health benefits space, improving the ways small and mid-sized businesses provide affordable healthcare coverage to their employees. We'll hear from experts on what works, what doesn't, and what changes they'd like to see. Making an appointment with your doctor can be stressful. Finding time, maybe taking off work, let alone the anxiety of trying to make sure you're as healthy as you can be. Add in out-of-pocket costs like copays, deductibles, and uncovered services, and going to the doctor gets that much easier to put off. But even if you save those dollars up front, what is the cost to your health? What if it's a serious procedure you're in need of, but the price tag is just too high? Traditional benefits plans set limits on out-of-pocket costs, but those limits can be as high as $10,000 or more. So for many, a medical emergency means either forgoing care or incurring medical debt. This has a domino effect in the group market as employees carry that physical and mental stress of high medical costs into the office with them. To help explore this impact, we have Asia Evans, an LMHC and mental health professional with a focus on financial stress. But we want to go beyond the problem and talk about solutions. It's a Gravie thing. For that, we've brought on Laura Cave, the Chief Marketing Officer of Paytient, a health payment account, or HPA provider. So, let's get right into it. Hey, Laura. Hey, Asia. Great to be here with you both today. We were just talking, the three of us, about some of the issues that affect employees who get their health coverage from their employers. And we're here today to talk a little bit more about what some of those financial pressures look like, what some of the unique circumstances are when it comes to access for workers who get their insurance through their employer group. As I was thinking about this conversation today, it occurred to me that for much of the public discourse on health insurance and health benefits, much of that has historically focused on the uninsured. Obviously, healthcare reform that was ushered in 10 years ago did a lot for the uninsured. And I think sometimes we tend to forget that there's this group of people that I like to call the invisible uninsured, the people who have insurance but still feel like the costs of that coverage put care out of reach for them, and as a result, forgo getting care. So you have a lot of people who might get their health coverage through their employer, yet because of copays, because of deductibles, because of premiums, and then frankly, exorbitant out-of-pocket costs, they choose not to get care and essentially live their lives as uninsured people. Laura, I know that with your work at Paytient, you all have really been looking at this issue. In fact, I think it was probably the impetus for Paytient.
Yeah, we have. The out-of-pocket cost is a huge barrier to care. And this was something that we wanted to really understand better. A lot of the studies that have come out about deferred care often lump together those uninsured or people in various types of insurance. And so we actually commissioned a study that we put out last week from Nonfiction Research, a really reputable third-party research firm. And it's called The Hidden Pain of the American Employee, because it found just at the top and a lot of detail underneath it that 40% of insured Americans, those who get insurance at work, are deferring care due to cost. They're not going to get care. And in fact, when we speak to our own users who use the patient card and they get that from an employer, 54% said they would have skipped some or all care without a way to pay like the patient card. And so that's why, we're really passionate about giving people a way to pay those out-of-pocket costs and smooth those expenses over time, because they're really usually very unexpected. And so turning something that's an unexpected expense that can feel really stressful, right? And turning that into something that's planned, it turns out that that's really powerful. And that's something that's built into Gravie with our partnership, Patient Powers, Gravie Pay. And I think more and more we're going to start seeing that these forms of payment as a resource alongside the health plan is going to be like a new standard, that if you don't have something like that, and you have out-of-pocket costs, you're really exposing people to a lot of stress. That's going to keep them from going to the doctor.
Yeah, I mean, I think that's exactly why at Gravie, when we launched with our flagship plan Comfort, which provides zero copay, zero deductible coverage on basically almost 90% of healthcare services, the routine care, the things that you know you're going to need. But we worked with Paytient because we knew that, well, that's fantastic. That will hopefully help people get the care they need. But what about the times that their coverage doesn't kick in? What about those out-of-pocket maxes that everybody who has some kind of health benefits is subject to? And so, with Gravie Pay, we're able to partner with Paytient to bring in that interest-free credit card that allows our members to pay their out-of-pocket expenses with the zero interest on their own custom payment terms up to 12 months, which I think addresses exactly what you're talking about. It's like, well, let's help them at the outset. Let's help them with those copays. Let's help them with those deductibles.
Right.
Let's make sure that they're not foregoing the care they need because of a copay or deductible. But we also know that those higher expenses inevitably will probably hit them at some point through the course of their coverage, and we want to make sure that they don't have to live with medical debt or with an illness that could have been prevented had they gotten care.
That's right. That's right. And what's so interesting too is that, these types of solutions are really different from, say, the payment plans or the medical credit cards that get offered at most care providers today. A lot of employers might think, oh, well, if they need help paying their medical bill, can't they just get a payment plan or a medical credit card from their provider? And they can. Those are really ubiquitously available. The problem is Americans have spent something like $1 billion on interest on medical credit cards. The CFPB reported that last year. And actually, the White House and the CFPB warned against these types of financial vehicles because of how much interest is attached to them. I think I saw one that was 29%, and they have really confusing terms. And what's fundamentally different about these is that when you have a payment solution or a no-cost health plan like what Gravie offers, up front, you're more likely to go seek care prospectively.
Yeah.
You're more likely to walk into that specialist visit that is the follow-up that you were supposed to get, or to go get that lab test that you needed to check your levels. With these medical credit cards, it's often a retrospective, a reactive solution because things got so bad. I finally went to the provider not knowing how I could pay for it. And now I'm stuck with this where I'm paying interest on top of a really big bill I wasn't expecting.
Yeah, that's so interesting. I mean, I think the credit industry saw these folks as an opportunity, which is why I think the onus is on the health benefits industry, like what Gravie's doing, to find alternative solutions to financing care that don't lean into some of those predatory lending practices. And it strikes me that oftentimes I think employers, particularly those who are making the decisions on which benefits to provide their workforces, while they're thinking about their employees, they probably also are at a certain point in their career where they're thinking about out-of-pocket expenses as something they can manage. I found a Kaiser Family Foundation report that I was shocked to find that 32% of insured households have less than $2,000 saved. Mm-hmm. So I think if you put yourselves in the shoes of the average American worker, a $5,000 out-of-pocket bill can really bankrupt you.
Oh, yeah.
And Asia, I know that you probably see patients all the time who are struggling with that very thing.
Yeah, and I think it's really important to look at this. That number is higher than I had heard in the past. Like, thinking about that, the past numbers that I've heard is that people can afford a $400 emergency. And for some people, that could be a flat tire. That could be a large grocery bill. That could be Christmas. That could be Thanksgiving. So these are everyday things that we have put into our life and our lifestyle that average Americans can't always afford. Now you think about a birth or an unexpected emergency, and then you have people deciding whether or not to go to the emergency room or not. And just personally, I have my insurance through my husband because I work for myself, and that can get very, very expensive. And I had to go to the emergency room last year on New Year's Day because I cut my finger on a glass. I was just like washing the glass. It broke. I cut my finger. Went to the emergency room, was trying to get the information about like, hey, how much is this going to cost? This is my insurance. Wasn't able to get a concrete answer. But after that, I had an $1,100 bill. I got 6 stitches, and then that was the bill, and that was just it. And we're in a position where we're prepared and can pay for it, and we have an HSA, but some people are not ready for that.
Yeah.
And $1,100 is like, okay, do we keep the lights on? Do we pay our rent? Or what do we do about daycare? Do we take the kids out of daycare? It just turns into trying to compromise things that you need to survive versus, hey, this was really important. Like, I needed to handle this. Like, I needed stitches, you know? So thinking about the stress that comes up when people are trying to decide, do I take care of myself or do I make sure that I can take care of my bills and my family?
Well, and like you said, you're your own employer. I mean, imagine if after you figured out after you opened that mail and got that $1,100 bill, if you had to go to the office and put on a smile and do your job. I imagine you have a lot of patients who are less productive at work, who are maybe even taking days off of work for mental health days because of the financial burdens that they're facing due to their medical expenses.
100%. We know that APA does a study on stress every single year, and we know that money is usually at the top of that list within 1 or 2, and that is year after year. Financial stress is a huge thing for people. People are feeling really uncomfortable. And when we're stressed, and not just like, you can have a stressor that comes and goes, but chronic stress is the problem. And that's what's happening when people are worrying about whether or not they can make their bills at the end of the month or do ends meet. That's really hard for people, and it's really stressful. So that chronic stress is what keeps people feeling anxious and depressed and worried and stressed out. And with that comes high blood pressure and digestive issues and not sleeping well and not eating well. And
it begets more sickness.
100%. So we then physically are stressed, our bodies are stressed because our mental health is pretty much going down the drain because you're worrying about your financial stats.
Yeah. And I mean, Laura, I'm sure that's exactly why Paytient set out to do what it's doing.
Yeah.
For some of those very reasons.
That's right. And it has such an impact on the workplace. Not only are people stressed and struggling to interact in positive ways, that they're productive and having a clear impact on the company culture, but they're thinking about, okay, how can I go find a job that gives me better benefits? And that is a real source of turnover. And we found that when we survey people who use the patient card at work, they say 66% of them say I'm more likely to keep my job. 92% say I'm more satisfied with my health benefits overall, just because I have a way to pay for things. And that's been the thing that's been the most surprising to me in a year and a half coming to Paytient, is just what a difference this small thing, this ability to pay, makes for people in feeling like I can go get care if I need to. And the relief of that, it's just breathing room.
Yeah. And I imagine we haven't even scraped the surface just yet in terms of the number of employers who are thinking about costs this way. I think oftentimes probably the average person probably thinks, oh, I pay my premiums and I have health coverage. And that's why they get annoyed or upset when then they get a bill.
Absolutely.
That doesn't, because, sometimes you're just paying attention to the big things. I know that if I pay this monthly bill, that all these things that creep up, I'm not going to be paying out of pocket the whole time. But most people don't think about those out-of-pocket costs until they're facing them.
Well, and this is because—
And who budgets for that? No one budgets for the unexpected medical cost. You might budget for the unexpected school cost.
We talk a lot about the tyranny of now. And I think the employers feel this too. The tyranny of now is address your rising healthcare costs. right? Because these employers have been offering health insurance because they have to, and because that's like the core of the health benefits program. But the costs have grown astronomically for them because we removed lifetime limits with the ACA, which was super important. But what that's done is it's created sort of this infinity market for very expensive solutions, which, thank God, are genetic therapies that are solving disease that have never been there before. But guess what? It costs $3 million, right? If someone needs it. And so the cost of insurance has grown dramatically in the last 20 years. And as a result, our deductibles have lifted up over our heads of what we can afford. And what I love about Gravie and what Paytient is doing is that we're operating in that space before the traditional deductible might have been met, and creating low or no cost solutions to allow people to access care with choices, right, of being able to go to a range of providers and have a way to pay. And that really, it relieves the stress out of seeking care entirely, and actually changes behavior in ways that are really valuable for employers, it turns out.
That comes up a lot with some of my clients, because when you're looking at, hey, does my insurance cover mental health, and how does it cover mental health? And
Huge.
I need a specialist for this, and what does that look like? And, there is a lot of strife between providers and insurance, and how do you handle this, and what do you do, and how are we getting reimbursed and paid and whatnot. But at the end of the day, it is for our clients, it's for our patients, it's for them to get their care that they need. And I've had people try to back down the amount of times that they're seeing me because they're like, okay, well, Asia, I don't know if I can afford this. And I'm like, I hear you, and I'm happy to work with you any way we can, but you are still very anxious. Like, you are still having anxiety attacks, and it does not clinically feel appropriate for us to be lessening how often you see me. And I want to keep seeing you, but we have to figure out how this is going to work for both of us, and feel comfortable, and that you're safe.
Right. Like, if you're trying to help someone with their anxiety, but your bill for your services creates anxiety, what do we do?
But it's interesting. Laura, you talked about medical advancement, and which is wonderful. I mean, we've got all of these new ways to treat people, but the underbelly to that is all these people are coming to the market with solutions that hopefully can help people, but they all have a cost, and no one wants to pay it. Everybody wants someone else to pay it. And at Gravie, we talk a lot. We have this saying. We say, the way health benefits work today, it's a zero-sum game. And we don't think it should be a zero-sum game. Isn't there a way that everybody can win?
That's
I think with, the partnership that Gravie and Paytient even have is an example of let's think about this. Like, your employer's winning and the employee's winning if the copays and the deductibles for most of that care don't exist. If you're able to provide the Gravie Pay card and this, safety net of sorts to help you pay for your care if you do need that, everybody's winning a little bit, right? The employer is winning because they have an employee who feels safe and protected by their employer. The employee is winning because perhaps they have a little less stress. They had to get that care, but now it's not all on them to pay today. Paytient and Gravie win because we want those folks to use our services if they are getting care they need without the fear of getting coverage costing them money. Then they're hopefully staying healthier, which ultimately lowers costs for everybody in that group. It doesn't need to be zero sum.
Right.
I'm curious, Laura, as I started to say earlier, I think we're just scraping the surface. And I imagine that there's 60 million people in America or more who get their coverage from small and mid-sized employers. And so, I want to focus the conversation a little bit on that population, because I think even within the group insured market, there's, levels of inequity depending on what size your group is, whether it's large, whether it's medium and small. And, like I said, there's 60 million people who work for companies that have fewer than 500 employees.
Right.
Where are we, Laura, in terms of, a tipping point when more employers, particularly small and mid-sized employers, start recognizing that there's more they can do when it comes to ensuring access through their benefits plans?
Well, I think that it has to be now when this starts to change, because we know that small and mid-sized firms especially are experiencing incredible cost increases in their health plans if they take a traditional fully insured sort of health plan approach. And, upmarket, larger companies are taking more of a point solution approach, or they're creating centers of excellence to try to use their volume to drive costs down. That's not an option for smaller firms. And so, and point solutions, historically have said, here's a cost center inside the claims, and how do we address that by making it better? So that's why you see musculoskeletal, solutions, or diabetes or chronic care management solutions, things like that. But if you don't have that scale, it doesn't make sense. And so what I think is really powerful about what Paytient is doing and what Gravie is doing is saying, how can we either redesign the health plan or support the health plan as it exists with things that give people those first dollars, that access to that primary care, the specialist care, with a Gravie plan, that's $0 copay. If you use your current plan and you add Paytient, that's easy to pay for.
Sure.
Over time, split the cost up across a few months. And what that change in thinking is we're not going to layer on a point solution to try to lower costs. We're going to get people earlier access to the early treatment. It's the diagnostic care that's so important. And by the way, it's the most stressful time, right? Because preventive care is just a screening. If you actually think something's wrong with you, you have to pay for the diagnostic services to find out what that is.
Yeah.
And when you're talking about testing, for example, for like if a woman finds a lump in her breast, that's an ultrasound, that might be a fine needle aspiration or a core biopsy. Those are procedures that could cost $2,500 out of pocket in a traditional health plan, even with a low deductible, just to find out that you don't have cancer.
Right.
Because those are really common, and the anxiety that goes into, do I have cancer or not, is like incredibly stressful for mental health, and to have money in the way.
Right. And if I do, how am I going to pay for it?
Of that peace of mind, it's a terrible position that we've put people in. The more employers start to think about, how do I get people access to early treatment? How do I get them access to the care that they need to diagnose and begin a journey of healthcare? And how do I keep them on that journey?
And are they thinking that? Are employers thinking about that yet?
I don't think they're thinking about the finances of that.
Right.
I think they assume that the health plan is enough. And it's certainly a huge investment for them. But if there's cost sharing, there's a lot of people that are not on that road. I've been thinking about it lately it's like a phantom toll booth. If you can't get through the toll booth, you can't get on your way towards feeling better. And 50% of Americans only need $1,500 of care in a given year. And we're spending so much money to insure against these mega risks that very few people actually experience. And so if you think about the experience of how are they going to feel seeking that just first $1,000 of care, if you pay attention to that experience, your employees will love you.
Yeah.
And that's been the most astonishing thing to me. Paytient has a 90 Net Promoter Score. I've never heard of that. I come from marketing world. I thought the survey was broken because
because
so
you're dealing
hard.
with people who thought that they were going to have to pay these costs. It's only an upside, right?
Yeah, and so just the geyser of goodwill that comes from paying attention to the experience of just the first few dollars and the peace of mind around that. I think choosing health plan solutions like Gravie, choosing financial solutions like Paytient alongside your benefit mix, whatever that looks like, is so important today, and that the payoff in employee experience is just astronomically bigger than I ever thought it could be.
Well, and what I would say too is what I've found with my clients is that when people are stressed out about work and when they're stressed out about money and life as well, but something particular about work and money, it has a way of seeping into all aspects of their life. And to a point that you had brought up earlier around retention, if your employees feel like, oh, I'm really happy with these benefits. I really feel taken care of. I want to stay here. I don't want to look for a job. I am okay with making the salary I'm making because of the benefits I'm getting. And there might be other jobs that I could make more money, but I don't know if I'm going to get the same benefit structure that I have here, so I don't want to leave.
Yeah.
And listen, happy people make better workers. They just do.
Oh my gosh. Yeah.
And that is really important for people to realize, and for employers to realize that, hey, what is going on with our staff? Like, what do they need? What do they want to feel? And if $1,500 is the cap that people need, like, how do we just make that happen?
Right.
For everybody.
I'm so glad you brought that up, because one of the things that we asked in a recent survey of cardholders was, how do you feel? Like, what does it mean to you that your employer offered you this benefit? And it was a write-in question, just like no multiple choice, just like, tell us. Yeah. And a bunch of people just put like, it means everything. Yeah. It means a lot. It means, and there was all this expression of gratitude and peace of mind and access to care. And those were kind of the things that I expected. But then this other theme, like 20% of the respondents wrote in some version of, it means my employer cares about me.
Yep.
Oh, totally. And I mean, because I do think that the typical employee has come to assume they will be given health benefits of some kind. And maybe they compare them to their significant others or spouses to see, well, whose coverage should we be on? But what you just said, Laura, I think is the silver bullet. It's like, to what degree can employers use those health benefits to create that affinity for their brand among their employees? And we talk a lot about employer brands and, making sure that your employees are representative of the brand. And, what better way to do that than to give your employees things that are actually going to make them feel seen, respected, and cared for by their employers. And you said something earlier that made me think of a stat I saw yesterday. At Gravie, I know that so we've piloted Gravie Pay in 2022. This year in our renewals, Gravie Pay is included for all employer groups. They can opt out, but I think we have like 98% of our groups now are offering Gravie Pay. What's interesting, and I guess it's not that surprising, but I want to make a point here, is that more than 85% of the folks, our members who are using Gravie Pay, who have had at least one transaction on their Gravie Pay card, are paying over $7,000 a year in out-of-pocket costs. So it's working the way it's intended. The people who don't need it are not using it. And, it doesn't cost their employer all that much from a per employee per month cost to actually offer that card. And, we also talk a lot about how, I've heard this stat, and forgive me if it's not exactly correct, but something like, 90% of the care that one group might be paying for is related to 10% of the group's population's medical costs.
That's right. Yeah.
So if we're doing that, if we're really cost sharing that way, then why not provide this, mechanism for interest-free financing for the people who really need it?
Absolutely. And,
if you don't need it, you don't use it.
Gravie is like fantastic because all of that early treatment, all that diagnostic care, most of that can be handled with no out-of-pocket at all. So the use case for Gravie Pay is just in those like emergency situations. For those who aren't lucky enough to be on a Gravie plan and they have Paytient, similar, exact same product essentially with a different name, the average transaction is actually only $130, and the average repayment timeline is 6 months.
Right.
Less than 6 months, actually. So what's interesting is that when you do have those smaller out-of-pocket costs on a different type of health plan, people are really appreciative of the ability to even spread those things out. Because to your point, affording a $400 emergency is not something everyone can do. And we're actually really pleasantly surprised that once they use the card once, 85% will use it again. And that's because, this worked for my doctor's visit. It also works for my medication.
Sure.
And my dental visit and my glasses and, all these other pieces. And so that's been really cool to observe.
This is where I think employers have a real opportunity. I started my career as a journalist covering health policy in Capitol Hill in 1999. And as long as I can remember, there's been this debate over, well, why should your employers have anything to do with your health care? And, there's lots of arguments for and against that. I think this is one of the greatest arguments we could make for the opportunity that exists when you involve an employer in, and folks' health benefits, because employers have the opportunity to step in and say, well, listen, I've got responsibility for these people. They're part of our tribe.
Right.
And, you know, if not me, who? And so by finding solutions that are outside the box, you know, we talk a lot about it's, you know, with Gravie, your health benefit your health plan shouldn't just be your medical coverage. Your health plan should give you financial support. Your health plan should give you, you know, integration with the different people that you're working with to coordinate your care. It should do a lot more than just cover your medical expenses.
Right.
And I think employers are the tip of the spear there, because they have the opportunity to say, this is what employees deserve to get. This is what employee-sponsored health coverage should look like. We can't just say, pay your monthly premium, pay some copays, pay some deductibles. Let's be more, let's be critical thinkers about this.
Yeah.
You know, and think about, like, let's actually put ourselves in the patient journey and think, okay, here, you know, and Asia, I think part of that patient journey is understanding what this all feels like.
Yes. And knowing what it feels like, and to your point, it is stressful. So if you are an employer taking away that level of stress and bringing that down, then it really just impacts your employee's life. And I'm going to make that general statement and say, like, it impacts all aspects of their life. If they feel better, they might be healthier, they're more apt to exercise, they might be sleeping better, they're taking care of their family. That can create a whole happy human. And that is the actual goal, that we are helping people strive to live authentically and be happy in that life and feel good about coming to work and feel good about going home, and knowing that if they're being taken care of physically, then and mental health wise, that it's okay for them. So I think zooming out to just say, like, we want people to be less stressed overall. Like, just like walking down the street, it's not fun if everybody's stressed out and yelling and screaming, right? Like,
well, aren't they anyway?
I mean, sometimes. But if we're taking care of people in general, then it's just a lot easier for all of us to be around each other and feel good about that. And people's bottom lines are being met and feeling good about that, and they're productive. And humans just feel better. I mean, I'm not trying to put myself out of business, but I'll be put out of business if everybody's happy.
Right,
This is what it is. If that's what it means,
you'll figure out something else.
I will do something else.
Yeah. We'll just get rid of the financial stress.
Right? Sounds great.
And, you know, and I bet, Asia, none of your patients are telling their employers that they're dealing with a medical issue, that they have, you know, that they're bedridden with anxiety over how to pay for it.
They're telling me.
Right. And meanwhile, you've got employers who are there wondering, you know, why is employee X, you know, they haven't been showing up at work lately. They haven't been themselves. They, you know, when you're doing reviews, like, you know, and you think about what does that employee carry with them in the world and what they bring to the work. I mean, obviously you expect your employees to shed some skin and come to work as their best work selves, but we're all human. And if you're struggling with, you know, crippling anxiety and stress over financial matters, you're not telling your employer that, and they might just be wondering what's going on. And so there's this disconnect, I think, between how people show up at work and how they're really living, you know, what's really happening to them. And I think this is at the crux of a lot of that.
And I would also say, how do they articulate that to their employer, right? So I think that not everybody feels comfortable just saying, like, hey, listen, I do have crippling anxiety and this is a big deal for me and it's really impacting my work performance, but I want to be here. Having those conversations, you figure out individually what feels right. But if you feel cared about by your employer and the employer cares about the workforce and your employees, it makes it a lot easier to jump that hoop, right? To jump that gap in how do I have this conversation? I'm not telling you to disclose all of your private medical information, but if you feel comfortable and you feel like your company actually has the resources to help you, you're more apt to say, listen, I am going through something right now and I'm going to utilize some of the resources, or your manager can tell you what some of those resources are that the company may have. And I'm hoping that this is going to get me back to a place where I feel really healthy and I can still be here. I do not want to leave.
Yeah. You know, it's interesting. I mean, Laura, I wonder if in your survey that you've recently done or in any other data you've seen, you know, to what degree are employees proactively telling their employers, I need help with out-of-pocket costs? You know, I wonder if an employer said, you know, tell us what you want from your health benefits.
Right.
How many employees would even think to say that? And how many employers are proactively thinking about that?
I don't know if employees know that this could be possible. In fact, a lot of employees, when we introduce patient, I've heard you all say you experience this too. We hear that, oh, it's too good to be true. What's the catch?
Right.
Right. So I think that employees are not asking for it yet, but this is a rising trend that's going to become more popular.
If we do our jobs well and more people know that these things exist.
I mean, it is our life's mission.
Then yes, more employers will be getting knocks on their door from their employees saying, what about this?
But I mean, Medicare starting in 2025 is going to be offering payment plans alongside the pharmacy program. So if your pharmacy, your medications are expensive, you'll be able to smooth those costs over future months. And Congress has legislated that into Medicare. And that's one of the reasons that we believe this is a trend that's here to stay.
Oftentimes what happens in Medicare first ultimately makes its way into private insurance.
That's right. And it's already in private insurance through our two organizations. And so I think that's really powerful. But I'm glad you said what you said about how employers aren't always going to be aware that this is going on. There might be employers or brokers listening thinking, oh, this isn't happening in my group. But
definitely is.
The data, yes.
It definitely is.
She's like, they're telling me.
They're telling me it
and
is.
the data that, in the study that we just put out, it's something like 1 in 5 insured Americans says they have an unresolved health issue that's impacting them at work. And that impact leads to behaviors like lying about where they are to their boss, hiding in the bathroom, not showing up in the way that they should be, taking care of health issues while on the clock. These are all the types of things that, that keep productivity, suppressed. And so I don't blame employers for not knowing this,
of course,
because people are so hesitant to share the things that are difficult in their lives with their employer, especially when they're trying to perform at work. And so I just wanted to say that because I think,
of course,
anybody listening who's like, this isn't real, like, it is.
Yeah.
And you're not supposed to know.
Yeah.
It's supposed to be hidden from you.
Well, and
so
that's
it's not
the
an
role of a
indictment
broker
on
too.
employers.
Well, broker, the brokers are always, I know the brokers I know care a lot about bringing new and innovative approaches to their employer clients, and employers, especially people who spent their careers in human resources, care a lot
they
about
really
this.
do.
And so you're right, the intent is there for sure. It's about showing them what's possible and through things like this.
Yeah. Yeah.
Well, there's, a lot that can be done in this space. It's exciting to know that we're seeing a little bit more uptick in recognition of what access really means within an insured population. Access is not just a term to be applied to the uninsured.
That's right.
Because the data show that insured people do not have access to the care they need because of costs.
That's right.
So I'm excited to see the report that's coming out. Tell me again the name of the report.
That's right. It's called The Hidden Pain of American Employees. And there'll be links to it at paytient.com, and we'll share those with the show.
Awesome. And Asia, I know you're also doing some thought leadership in this space. I believe that you have a book coming out.
Yeah, my book is coming out in December, so that's really exciting. Feel Good Finance. And it's pretty much just walking people through where their money stories come from, why do they feel the way they feel about money, and kind of how to interact with their money in a way that can lower stress.
I'm curious, as you set out to write that book, did you speak to any employers?
And
in the course of your practice, do you have the opportunity to speak to employers or educate employers?
So no, the way it comes up with employers is that they may bring me in to have some of these conversations as an employee benefit to say, hey, are you thinking about your financial stress? Are you thinking about your financial anxiety? How do we speak to that? And then what can we do to make sure that you're getting some of the services that you may need? So I'm coming in more as a speaker or workshop expert to just have the conversation with the employees to just start, kind of mulling this stuff around, chewing on it, and deciding.
It's got to start somewhere.
It has to start somewhere, and a lot of people don't know.
Yeah.
So,
and this is uncomfortable stuff. People don't like to talk about
100%.
money,
Yeah.
and so it means they don't like to talk about their exactly. They don't like to talk about their health care, but who wants to admit they can't afford their health care?
Right.
So and people don't. This is kind of like one of those things that we keep sweeping under the rug. And if we just attack it head on and say, look, let's just offer this. Let's make interest-free financing for out-of-pocket costs and for other healthcare costs something that your employer is just going to. It's just it's part of it. It's just
a standard of care.
It's a standard of fare. Exactly.
Yeah.
And I think we'll get there. Because I think we're seeing a lot of momentum in the employer-sponsored market now. I think companies like Gravie are forcing the issue, and I think the more we do that, and the more brokers and employers see the value in that, the more demand there will be, and the more supply there will be as well.
That's right. And it's like there's plenty of reasons for people to feel financial stress in today's environment with inflation the way it is and everything. We don't need to create financial stress with our health benefit and then solve it with a benefit like
Yes.
Asia coming in to counsel our
Exactly.
team.
Right.
So I think it's
I mean, you
both,
said you want to
know?
be out of business, Asia. So.
I
Well,
do,
we can at least
but in
take one
different ways.
reason off the list
Right,
for people that
exactly.
feel financially
Totally
stressed.
fine with that.
Yeah.
And I think at the end of the day, people are working typically because they need money, right? Like we're working because it's valuable. We have a skill, and
That's why they call it a job.
right, it's a job, and that's amazing. But you want your people to be okay, happy at your job and at your place of employment.
Absolutely. Well, thank you both so much for talking with me today.
Thank you.
And,
Thank you.
Enjoyed it. That was a really interesting conversation, thinking about access from a different perspective, thinking about the emotional toll that healthcare costs have on folks, and frankly, how they bring that toll into the workplace. Our most sincere thanks to both Laura and Asia for joining us on this episode of It's a Gravy Thing. If you'd like to learn more, head to gravy.com. It's a Gravy Thing is produced by Gravy in partnership with Pod People. Thanks so much for listening, and if you liked what you heard, rate and review the show. And of course, subscribe to It's a Gravy Thing to make sure you never miss out on a new episode.